Hello, friends. This is Dr. Hotze, and I believe that you and everybody needs to have a physician and a staff of professionals who have the wherewithal and the know-how to coach you on the path of health and wellness naturally. So as you get older, you got energy, you got vitality, and you're enthusiastic about life. I'm talking about my favorite subject today, thyroid, hypothyroidism. In 1992, I was attending the Pan American Allergy Society conference here in Houston, and Dr. Dick Mabry from Victoria was a member of the society. And Dr. Mabry came up and said, Steve, you know, you've got a lot of patients and a lot of women in your practice that have hypothyroidism, they're low thyroid. I said, I do? He said, you do? I said, really? Well, what do I do for them? He said, you give them thyroid. You give them desiccated. At that time, it was Armour thyroid that we were using, and he recommended that. And he said, these women and men many of them have autoimmune thyroiditis. They make antibodies to their thyroid gland. Those antibodies, of course, will bind up thyroid hormone so you can't get it into the cell. So I was going to double check on Dr. Mabry, and I talked to the dean of our society at that time. And I asked him, I said, Dr. Mabry says that I've got a lot of women with hypothyroidism. And he says, you do? I said, well, what do I do to treat them? He says, use Armour thyroid. I said, why do we use Armour thyroid? Why wouldn't we use the Synthroid or the synthetic thyroids? He says, because it works. And he was right. So when I came back to my practice, I began to evaluate everybody, starting in 92, to see if they had the clinical symptoms of hypothyroidism. And Dr. Mabry had recommended that I read a book by Dr. Broda Barnes entitled Hypothyroidism, The Unexpected Illness. So I read Dr. Broda Barnes' book, which was written in 1970, and it was fabulous. It opened my eyes to the problem of hypothyroidism. So let me explain to you about thyroid disease, particularly hypothyroidism. You're probably well aware that the thyroid gland is located in the neck. It's got the shape of a monarch butterfly. It produces thyroid hormones, of course. And the thyroid hormones that are produced are primarily two types of thyroid hormones. One called T4, which is thyroxine, and one is called T3, which is triiodothyronine. So you've got two thyroid hormones. T4, here's the thyroid molecule, which is made up of tyrosine, and it's got 4 iodine atoms attached to the tyrosine molecule. This is the thyroid hormone T4. 1, 2, 3, 4 iodine atoms attached to it. Iodine is very important. You can't make thyroid hormone without iodine. And there are areas of the country, before they iodized salt, there was a lot of goiters because people didn't have iodine in their food, and they couldn't make thyroid hormone. So, and then there's another thyroid hormone, T3. It has 3 iodine atoms. The T3 is the active thyroid hormone. The T4 is the inactive thyroid hormone. 94% of the thyroid hormone made by your thyroid gland secreted into the blood is T4, the inactive thyroid hormone. Only 6% is the T3, the active thyroid hormone. The inactive thyroid hormone T4 goes to the cells. It doesn't do anything in the blood. The thyroid hormone doesn't do anything in the blood. It has to get into your cells, inside your cells, and you have trillions of cells, 50, 60, 70 trillion cells. I lost count, somewhere around 35 trillion. That's T. That's a lot of cells, and every cell requires thyroid hormone to catalyze the production of energy, electrical energy within your cells. And it's the T3 that activates your power plants within your cells. Your cells have power plants. They're little factories, and the factories produce electrical energy. They are called mitochondria. You may remember that from biology. Mitochondria, mitochondria. Mitochondria are the power plants. Just like we have a nuclear power plant down in Southeast Texas that converts nuclear energy to electrical energy so we can have lights, so we can have air conditioning, so we can have our refrigerators working, so our mobile phones can have energy. We have to have electrical energy in our bodies as well. So the nutrients that we take in, the hormones and the vitamins and minerals, all are needed by the mitochondria, the power plant of your cell, in order to produce energy. And that energy is electrical energy. It's transmitted into the cells. It goes to the areas where the biochemical reactions take place, and it gives those processes the electrical energy that makes it happen. Think of yourself as a bundle of electricity. Now, those people that do really well are high voltage individuals. Here at the Hotze Health and Wellness Center, most of the people we see are low voltage. They're not making enough energy in their cells. And one of the primary reasons they're not producing enough energy is they're not getting enough T3, the active thyroid hormone, into the mitochondria, into the power plants. And there's a reason for that. Now, what the thyroid hormone does, it catalyzes the production of electrical energy within your mitochondria, within the power plants, so that your cells function normally and your organs function normally. So you can imagine if you're a low energy producer, you're going to have brownouts. You're going to have inability to think clearly. Your metabolism is going to be down. You're going to be fatigued and tired. Your weight's going to be a problem. You're going to have cold body temperature. You're not going to have good moods. You're going to have body aches and pains. You may have inappropriate bowel function or sluggish bowels. You may get recurrent and chronic infections. If you're a woman, oftentimes this leads to menstrual irregularities. It leads to infertility, so that you can't get pregnant, or when you do, you can't carry a baby to term because you don't have enough energy production within your cells. All of life being healthy is about good energy production within your cells. And if you don't get enough thyroid hormone within your cells, I don't care what your blood test says, if you don't get enough within your cells, then your cells are not going to produce adequate amounts of energy for you to live a vital life. So you're a live wire. You've heard that expression, haven't you? Boy, that gal over there, she's a live wire. Well, look at him. He's a live wire, isn't he? We have that in just our normal nomenclature, in our lay terms. We talk about people being high energy, live wires. And some of you, at one time in your life, were live wires, but now you're like a dying wire. You just don't have the energy. And one of the primary reasons for that is that you're not getting enough active thyroid hormone. Now, let me explain to you, there's some other things that go on. We have petrochemicals in the environment which poison our mitochondria, our power plants. We have exposure to metal, mercury in our teeth, aluminum in our pans, lead in the water, a host of various metals that down-regulate our power plants and poison them so they don't function well. Interestingly enough, too much sugar is an inflammatory process, and it causes an inflammatory process, and that adversely affects your production of energy within your cells. It can lead to too much sugar in the form of grain products, corn, potatoes, rice, all these simple starches are simply sugar molecules hooked together, and when they're released, you get high sugar levels and you get insulin resistant. They drive it into fat, and your cells don't run well. So, and then if you don't get enough thyroid, you can't catalyze the energy production. So there are several reasons that a person can have fatigue, and oftentimes simply starts with poor eating habits. But in the vast majority of Americans with these symptoms of fatigue, difficulty with weight, cold sensitivity, cold body temperature, inability to focus or think clearly, mood swings, joint and muscle aches and pains, poor healing, ineffectual bowel function. With women, the menstrual irregularities that they have are the infertility, the puffiness, the loss of the lateral third of the eyebrows, the pasty skin, the enlarged tongue. Stick your tongue out, look in a mirror. If it's got scalloping around the borders, it's enlarged, it's growing into the teeth, and it's getting that mottled scalloping effect. So, and if you get that pasty look on your skin, these are all symptoms of hypothyroidism. They're signs and symptoms. So what happens is, and so one of the reasons this is caused by is the inability of the body to correctly convert T4 to T3. Let me tell you why that happens. Fluoride in your body. How do you get fluoride in your body? You drink it. 70% of the drinking water in America is fluoridated. Fluorine is a halogen. Go back when you were in high school chemistry. Remember the periodic chart? One of the sections is halogens. Iodine is a halogen. Fluoride is a halogen. So is chlorine and several other, bromine and several others are halogens. So they're in the same class. When you put fluoride into your body by drinking it, or you're getting it in your toothpaste, what it does is it competes with the iodine, so you can't make your thyroid hormone effectively. It also goes into your cells and it poisons an enzyme in your cells called the deiodinase enzyme. That enzyme in your cells takes inactive thyroid hormone T4. Remember, 94% of all the thyroid in your body is made is T4, made by the thyroid gland. The deiodinase enzyme would cleave off one of the thyroid atoms and convert it to T3, the active thyroid hormone. But fluoride poisons that enzyme. So you can't get enough active thyroid hormone into the mitochondria, into the power plant to cause combustion in order to produce energy. Think of the thyroid hormone as a spark plug. It's like driving around an 8-cylinder car, but you need 8 spark plugs. You only got 7 or 6 or 5. It's going to run very rough. It'll run, but it's going to run at a low energy production level because you don't have all the spark plugs. You're not hitting on all spark plugs, all cylinders, as they say. You've heard that expression. Well, he's sure not hitting on all cylinders today, is he? That means he's low energy. He's not thinking clearly. He's not doing well. And that's because we don't produce enough energy in our cells. That's why people get sick. All of health revolves around good energy production within your cells. You need that so your immune system is healthy, so your brain's thinking clearly, so your heart's beating regularly, so your lungs are working, so your kidney is detoxifying, so your bowels function right. That's so critical to have good energy production in your body. And I would suspect that many of you that are listening to this today are low energy producers. Now, some of you have come here to the Hotze Health and Wellness Center, maybe a majority of you, and you know how we treat that, and you've regained your energy. And when you regain your energy, you regain your life, right? Okay, so what I did, I'm going to go back. Dr. Mabry said you got a lot of people with low thyroid. So I read Dr. Rhoda Barnes' book,
a link as well.
Hypothyroidism, the Unsuspected Illness. This is a great read. You know how he discovered about the hypothyroidism back in the 1920s when he was studying in a doctorate program. His professor told him, what I want you to do, we're going to study thyroid hormones in rabbits. And what they would do is they would take the thyroid gland out of the rabbit and see how they did. And inevitably, they got sluggish. Their energy went down. Their body temperature went down. Their hair started falling out. And that's another sign and symptom of low thyroid, particularly in women, was they get hair loss. Men's mind is like male pattern baldness. Nothing that a good hair transplant wouldn't cure with me. Not going to do it. Don't have time. Don't think I have enough hair left to do it. Anyway, he took the rabbits, cut out their thyroid hormones and monitored them. They got sluggish. They got overweight. They didn't move well. They didn't think well. They had sluggish bowel function, all these symptoms. He ended up, and then they would give him some thyroid and they'd perk back up. Well, he went off to med school and then went into practice of medicine. And what he found is that when patients came in midlife, he started thinking, my goodness, these patients remind me of the rabbits that I had. Back in those days, they didn't do blood tests for thyroid. It was a clinical diagnosis, and he started thinking, I wonder if they would benefit from thyroid. He began to use desiccated thyroid, which is dried thyroid. Desiccated means dried. He used to use pork thyroid. Porcine thyroid comes from pork thyroid, contains the same identical hormones our body makes, T4 and T3. And he began to supplement these individuals with the thyroid. And my gosh, they recovered. It was amazing. And so he spent his whole life studying thyroid. He's got some amazing studies in here. He went abroad to Austria and Europe, and into Austria to study thyroid there. And it was fascinating what he found in old autopsy reports back from the 1800s. So anyway, I began to adopt his philosophy and began to test people first and foremost by listening, by asking questions. And of course, I would do blood tests. Here's what I found out. 95% of the people that we did a blood test for TSH, thyroid stimulating hormone, and other thyroid hormones, and thyroid hormones themselves, TSH is not a thyroid hormone. It's a stimulating hormone, thyroid stimulating hormone. So what I found is that 95% of the time they came back within the normal range, but the individuals, our guests that I was evaluating, my gosh, they had all these signs and symptoms of low thyroid. And they told me they'd been to other doctors and had thyroid tests, and the doctors had said, well, your tests are normal. They'd gone to the doctors thinking that maybe they had low thyroid because they had read about it in the Ladies' Home Journal or any other magazine or Reader's Digest. All these magazines were very popular at the time. And there would always be an article every year about hypothyroidism. The ladies particularly would read this and go to the doctor and say, could I have this? And they said, what makes you think you have hypothyroidism? Well, I read a Reader's Digest. Oh, you shouldn't be putting those articles in there. It gets you all confused. Well, I want to get a blood test. Well, your insurance doesn't cover it. Well, please test me anyway. I'll pay for it. So they get the blood test done, and inevitably they would be told by the doctor, usually not the doctor, but usually the nurse 2 or 3 weeks later, that they had good news for them, that their thyroid hormones were normal. And they would say to me, but I don't feel normal. And I explained the reason. 95% of the people fall within the wide range of normal on their thyroid hormones. Now listen to me closely. First, the doctors in America, conventional doctors, have been trained, and they've been trained by their clinical endocrinologist to look only at blood tests to determine whether or not you have hypothyroidism. And here's how the lab determines the range. It's not the doctors, they don't determine the range. The laboratories do. And what the laboratories do is they take an average of the last 1,000 blood tests. Mind you, this is a moving average. Every day they have thousands of tests, so they have this mean or average every day. And this average or mean is where half the people end up. Right in the mean. It's a bell-shaped curve. They take 2 standard deviations, which is a statistical term, beyond the mean on either side. Is that they say that is the normal range. Well, that encompasses 95% of the population. So 95% of the people that have a blood test always fall within the so-called normal range. And it's as wide as the Grand Canyon, tall as the Empire State Building. You can't hardly fall out of the range. But you may have all the signs and symptoms of low thyroid, but the doctor goes, well, you're in the normal range. And you know what they do to you, particularly ladies? They think to themselves, this is another hypochondriac. I was taught in medical school by my dean, Dr. Chevis Smythe. He was from Boston, Massachusetts. In Texas, in West Texas, his name would have been Chuck Smith, but it was Chevis Smythe. And he was from Boston. And he said to me, and he said to all the students in the class, University of Texas Med School in Houston, this is my first semester on making a clinical diagnosis by history and physical. He said, if any woman in midlife has more than one complaint when you review her symptoms, she is a hypochondriac and must be placed on an antidepressant. So, ladies, you wonder why the doctors are offering you antidepressants all the time, because that's what the medical profession has been teaching about women since time immemorial. This goes back to the Greek days when women would have problems. They would have some problems around menopause. They'd have some emotional problems. They'd have anxiety, panic attacks. They get depressed, get mood swings. And this would happen around their menstrual cycles. Well, the doctors back there then called it hysteria. That's a Greek word for wandering uterus. These doctors realized that there was something related to the menstrual cycles, which was coming from the uterus, that affected women. They didn't know what it was. They didn't know anything about hormones. So over the years, whenever women have these problems that are related to a decline and imbalance in their hormones, they have historically been considered psychiatric cases or hypochondriacs. And the drug companies, of course, love that because they can make antidepressants, all the Paxil, the Effexor, you name it, Prozac, all the antidepressants. They give you anti-anxiety drugs, Ativan, Xanax, you name it. Give you sleep medication, diazepam. They can give you Linestra, Ambien, all these, which are all in the benzodiazepine family. These are all addictive drugs. They don't solve the problem. Nobody has problems of fatigue, difficulty with weight, poor thinking, mood swings, joint and muscle aches and pains, sluggish bowel function, hair falling out, enlarged tongue, puffy, pasty, loss of romantic moods and inclinations. It's not due to low levels of antidepressants or anti-anxiety medication or sleep medication. It's commonly due to hormonal decline and imbalance. And the most important hormone to give your body energy is the thyroid hormone. So I started to test the women in my practice. I started to do a blood test for antibodies to the thyroid gland. Antibodies are what your immune system makes normally to fight off bacteria and viruses. They make antibodies. When you take a vaccine, that vaccine is giving you usually some dead bacteria or dead virus, and it stimulates your immune system to build up antibodies that will block it. So if you get exposed to it, your antibodies will kill off the bacteria or virus before it infects you. Unfortunately, in some individuals, they get autoimmune thyroiditis. They begin to make antibodies from their immune system to their own thyroid gland. This is thought to be one of the causes is thought to be due to gluten insensitivity, but we know it's caused by an inflammation in the bowels to give you a leaky gut syndrome, and some of the food particles don't get digested well enough. They pass in larger molecules, the proteins, into your blood, and the body begins to make antibodies that cross-react with your thyroid gland. So we measure to see if anybody has antibodies to the thyroid gland. Those antibodies bind to the thyroid gland, they inflame it, and they can adversely affect the production of thyroid hormones. Routinely, the thyroid doesn't make enough thyroid when you have autoimmune thyroiditis. In a few percent of the cases, it will cause inflammation and leakage from the thyroid gland. So you get too much thyroid. You get too much thyroid, shaky, jittery, hot all the time, pacing the floor, can't stop your thinking. Bug-eyed, there's this exophthalmos, the bug eyes you see in the hypothyroid patients. We see few cases of those. We do see some, but it's much rarer than seeing the people with low thyroid, sluggish, low energy, and they have antibodies to the thyroid gland. In our practice, 28% of the women that have come through this office since 1992 and 18% of the men have antibodies to their thyroid gland. Now, the labs now say, well, if you have 30 antibodies or less, that's normal. There's no normality in making an antibody to your thyroid gland. Your body shouldn't be making antibodies to your thyroid gland. Those antibodies not only adversely affect the production of thyroid hormone, but they glom onto the thyroid hormone into the blood and bind it so it can't be received by the cells. The other thing, when women have estrogen dominance, as women move through their menstrual life, here's what happens. They have normal levels of estrogen and progesterone until they maybe have their first child or hit their mid-30s, and then they have low levels of progesterone. Estrogen's made all month, progesterone's made after the ovulation, and it balances out the estrogen. If you get too much estrogen, you have estrogen dominance. I write about this in my book right here, Hormones, Health, and Happiness. I have a chapter in there about estrogen dominance, or a section of a chapter. The estrogen dominance causes the liver to produce thyroid binding globulins. Guess what thyroid binding globulins bind? What do you think? Thyroid binding globulin. What would it be binding? Thyroid. Thyroid binding globulin binds thyroid hormones in the blood, so they can't get into the cells properly. So then you can't make T3, the active thyroid hormone, and your body runs sluggish. So autoimmune thyroiditis can be a cause of hypothyroidism. Estrogen dominance, which inevitably affects all women as they march through their menstrual life, and causes them to have invariably the signs and symptoms of low thyroid, some to greater degree than others. Then and birth control pills do the same thing. They cut off the production of progesterone in your ovaries, so you don't produce natural progesterone, and you get estrogen dominant when you take birth control pills. That will adversely affect your thyroid function. So it's very common to see women, probably 2 to 3 times as common to have women with symptoms of hypothyroidism than it is men. And inevitably, as I've told you, you go to the doctor, they do the blood test, tell you it's normal, and end up trying to give you a bunch of psychotropic drugs like you're a crazy person, which you're not. Here's my philosophy. I believe that if you have the signs and symptoms of hypothyroidism, you deserve a therapeutic trial of desiccated thyroid medication, T3 combination, T3, T4. You deserve to have that trial to see how you do. We start you on low doses and we monitor your symptoms. Now we'll do blood tests. We always do blood tests to see, 1, if you have antibodies to your thyroid gland, and 2, to look at your thyroid hormone, your thyroid stimulating hormone, and your thyroid hormones T4 and T3. We look at those to see where the range is. And if you're within the range, we'll continue to give you thyroid hormone until you feel well, as long as we keep it within the range. Now, let me tell you what I've done, because I don't believe lab. One time popped in mind, I don't really believe these lab studies. So I took the blood of 40 consecutive patients and I split the blood. I gave their blood to 2 different labs, Lab A and Lab B. And I found up to 50% different readings in the thyroid stimulating hormone and the thyroid hormones between these 2 labs. What lab am I going to believe? Lab A or Lab B? These labs have different measurements. They're not standardized. So I don't know which one to believe. Or I could believe the guest, the patient, what they're telling me. There's no blood test that can tell me how you feel. I can draw your thyroid hormone. If it falls within normal range, there's no way, just looking at a blood test, I can tell what you look like, what color your hair is, what color your eyes are, how you feel, if you have energy or not. I can't tell anything about your symptoms by looking at a blood test. The only way I can learn about your symptoms is asking you questions and simply listening to you tell me what's been going on in your life. And that's what we do different at the Hotze Health and Wellness Center than any other medical center in the country. We take the time to listen to you because we know that you know what your problems are. And your problems aren't shown up in the blood routinely. They can be in a small amount of cases, but routinely, the blood test doesn't tell us about the chronic problems individuals have as they age. There's not a blood test that I can do for a person that walks in who feels good and to see if they have any calcification on their arteries. I can do blood tests and everything can be normal. All your thyroid hormones can be normal, your cholesterol, and all this can be normal. LDL, HDL, everything's normal. I can't tell you whether or not you have any calcification on your arteries. There's no way I can tell that unless I do a heart scan. So blood tests don't tell you everything, and sometimes they can. If a person had an acute chest pain due to a heart attack, you go to the doctor, and if the cardiac enzymes are elevated, you've got, and the EKG's off, then or shows the signs of a heart attack, then you've got one. So in some cases, blood tests can be beneficial, or as far as an acute diagnosis, but for chronic illnesses that afflict men and women as they age, routinely the blood test won't tell you. Now, in men in the testosterone list, you can look at the testosterone and it goes down dramatically as men age. But they'll tell you about their symptoms first. So I'm really big on the clinical history because we have listened here at Hotze Health and Wellness Center to 33,000 guests, patients. We've listened to their problems, and that's a great cross-section of society we've listened to, and we know what goes on as people age and how the aging process is directly related to the decline and imbalance in your natural occurring hormones, your sex hormones, your thyroid hormones, and in many cases, your adrenal hormones. So on thyroid, here's what we do. We start you on a therapeutic trial of thyroid and we monitor you. We bump it up every couple of weeks, monitor you, see you back in a month, see you back in 2 to 3 months, keep in touch with you by phone. And when you hit the right level of thyroid, you're going to go like, thank you. I really feel good again. And I can't tell you the number of, we've treated more people here at the Hotze Health and Wellness Center for low thyroid condition using desiccated Armour thyroid. We don't use that now much because the drug companies have taken over that Armour thyroid and they've changed the incipients that hold it together. It just doesn't work like it used to work. We compound it here at the Hotze Health and Wellness Center. We compound our thyroid hormone and we get great results. And we've been doing that since 2009 when we started having shortages of Armour thyroid. Couldn't get it. They were closed down for 3 months. The FDA was going through and looking at them. And the pharmaceutical companies, trust me, don't want you to be on desiccated, which is dried porcine thyroid. They don't want that. They want to sell you their Synthroid at a very high price, the synthetic thyroid or the levothyroxine levothyroid. That's what they want to do. They want to keep that at a high price, and they want to knock out desiccated or porcine thyroid. They don't want you to get that. And our experience has been people that simply take the T4, that's the Synthroid and the levothyroid and the Levoxyl, which is just T4, which is the inactive thyroid pro-hormone. They don't do well. They come in with all the signs and symptoms of low thyroid. And I said, well, did you tell your doctor? Yeah, I told my doctor I had all these symptoms. And he said, well, it can't be due to your thyroid because your blood test is normal. So the inactive T4, if you're given that, it can normalize your blood test if you had abnormal blood tests, which only happens in 5% of the cases. But it can normalize your blood test. But normal blood test doesn't mean you're normal because that T4 has got to be converted to T3 in your cells to be the active thyroid hormone that catalyzes the energy production within your mitochondria, within the power plants within your cell. So many of you who are listening, low thyroid condition. You came to the Hotze Health and Wellness Center. We addressed that clinically, and you've dramatically improved. Then you go back to your doctor, and your doctor goes, what are you doing taking thyroid? You don't need thyroid. I'll check your blood. Well, you're on thyroid and your blood test is normal. Your test is normal. Quit taking it. A few patients will do that. They, well, the doctor must know best. Most patients just walk away or don't want to go back to that doctor because they know that doctor didn't help them get well to begin with. So we do things completely different than conventional medicine here at Hotze Health and Wellness Center. Why? Because we use it because it works. It helps you get better naturally. We don't put you on a bunch of pharmaceutical drugs, get you all drugged up with psychotropic drugs, or put you on Adderall to wake you up, to give you more energy, put you on a bunch of amphetamines, like many doctors do when people have low fatigue. They go like, they have chronic fatigue syndrome. We'll just give them some Adderall, give them some methamphetamine type of amphetamine. That's the craziest thing in the world. You don't need pharmaceutical drugs to be healthy and well. You need to eat healthy, eliminate your simple carbs. You need to balance out your thyroid hormone and your sex hormones and adrenal hormones. And you need to take proper vitamins and minerals and nutrients to enable your cells to produce and use energy. You need the nutrients from the food, you need the hormones, and you need the vitamins and minerals for your power plants to produce high levels of energy. So if you or your family members have the signs and symptoms of hypothyroidism, low thyroid, and you've gone to all your conventional doctors and all they want to do is drug you up, and they tell you you don't really have any thyroid problem, but you're not getting better, you're still sick and tired, and you're sick and tired of being sick and tired, then give us a call here at the Hotze Health and Wellness Center. You've got family members, you've got friends. I'm going to ask you to refer your friends here. We can help them. There are literally millions of people in America. I suspect, I know this, 70% of the population is overweight. Half of the 70% are obese. That's 35%. Now, I'm going to tell you why. It's due to hypothyroidism primarily. Poor eating habits combined with low thyroid will cause you to be overweight, will also cause you to, in that being overweight, half the time you're going to be obese. And that leads to a host of problems. Diabetic syndrome, it leads to high blood pressure, cardiac disease, it leads to Alzheimer's, degenerative joint disease, kidney dysfunction, a whole increased risk of cancer. In 1960, in America, only 16% of the people were overweight. 8% of the people, that's half of the 16%, were obese. Today, it's 70% overweight, 35 obese. We're unhealthy. You can just walk around and look at Americans that are unhealthy. You go to Europe and France and Italy, where they eat pizza and pasta, and they're drinking a lot of wine, and they're eating bread. Guess what? They only have 16% of the population overweight, only 8% are obese. That's the same thing we had in America in 1960. What's the difference in Europe and America? We put fluoride in the water, and fluoride poisons the thyroid gland. It poisons the thyroid enzyme, the enzyme that deiodinizes thyroid, converting T4 to T3. That's what happens in America. Go look on the side of your toothpaste. You're probably using Crest or some similar product. There's a label on the toothpaste or on the box that says, if you consume any more than what's on this toothbrush, call immediately, go see your doctor or call poison control. It's a toxin. Fluoride is a toxin. We carry Spry toothpaste here, and you may be able to get non-fluoridated toothpaste anywhere else at drugstores. I'm not sure. We carry it here at the Hotze Health and Wellness Center. There's no warning on the label because we don't put fluoride in it. Fluoride's a poison. Go to the material safety data sheet and look up fluoride and see what it does. It is a toxin, and they put it in your toothpaste. And the dentists, as stupid as this is, they put it on your teeth and your kids' teeth. Oh, it's going to help prevent cavities. Well, it doesn't. That's already been debunked. That whole idea of fluoride preventing cavities is debunked. They don't have any more cavities in Europe, and they don't put fluoride in the water. They don't have any more cavities there than we do in the United States in the same age group. There's no difference whatsoever. But it will poison your deiodinase and adversely affect your body's ability to utilize thyroid hormone. And you want and need thyroid hormone for you to produce adequate and an abundance of energy so you can feel alive again. So you've got energy, vitality, and enthusiasm for life. Thyroid hormone is a key ingredient, and I've seen it change tens of thousands of people's lives. And you know what they tell me? Thank you, Dr. Hotze, for getting me my life back. Thank you for giving me my life back. I said, I didn't do it. You took charge of your health, and you're the one that had to take your thyroid and your other hormones and your vitamins and minerals and eat right and do proper exercise. You did it. So if you are willing to take charge of your health, and I believe that you alone are in charge of your health, I also believe most problems that people have in midlife are preventable, including heart disease. And I also believe that you need to have a doctor and a staff of professionals to coach you on the path of health and wellness naturally. So you do have energy, vitality, and enthusiasm for life without pharmaceutical drugs. Then don't hesitate to call us here at the Hotze Health and Wellness Center. Those of you that have been here and feel well, I think you owe it to your family and friends to encourage them, and I'm going to ask you for the referral. Ask one of your friends today. Say, look, I know you're not feeling well. Why don't you go to the Hotze Health and Wellness Center? We're here to help you get on a path of wellness and help your family members and your friends. There are millions of people out there that need our help. The only people that are going to come, though, are people that are willing to take responsibility for their health and do a 180 in their health. Most of us are going, or most people are going down the highway on the wrong side of the road. And guess what? They're going to get whacked. You've got to get on the health freeway on the right side of the road so you go in the right direction so that you feel energetic again, so you've got energy, so you're healthy and well. And that's our goal, for you to obtain and maintain health and wellness naturally. Thanks so much for letting me visit with you today. And Next week, okay, here's what we're going to do. Next week, we're going to talk about hemp on the webinar, which is the CBD oil, cannabinoids. I used to be down on it. Now I'm up on it. And I'll tell you why in that presentation. We also have a hemp launch party. We're going to launch a hemp. What are we going to do? Hemp boat? No. We're going to launch our hemp oil topical party. It's going to be on Wednesday, February 19th. That's in 2 weeks, 5 to 7 p.m. here at the Hotze Health and Wellness Center, 20214 Braidwood. You just Google Hotze Health and Wellness Center, and you can find it. And Dr. Derek De Silva from New Jersey, who is one of the leaders of integrative medicine, is going to be here to talk with us. So you can find out about the event on the Hotze Health and Wellness website, hotzehwc.com, hotzehwc.com. Check your Facebook. We'll be there. So be sure to tell your friends about our weekly webinar. We'll be back with you next Thursday at 1 o'clock. We'll be talking about hemp oil. Thank you so much for giving me the opportunity of serving you. I look forward to seeing you when you come in to the Health and Wellness Center next time. God bless you and make it a terrific 2020.